Hello guys, myself Dr. Govind Rankawat. Today I want to discuss an important newer concept regarding COVID-19 which published in Journal of China. Till now medical science suggests that primary events of complications or death in case of COVID-19 is ARDS, but thing is different. As we know, COVID-19 virus enter in blood circulations via respiratory tract. In bloodstream, it binds to red blood cell membranes and engulfed by these RBCs. In red blood cells, it directly combined with one beta chain of hemoglobin. This binding of this COVID-19 with hemoglobin leads to dissociation of iron from porphyrin rings of hemoglobin, and this iron release into circulation. So deformed hemoglobin not able to bind with oxygen molecules, and thus it decrease oxygen carrying capacity of hemoglobin, which further produce tissue level hypoxemia. Due to hypoxemia, there is compensatory increase erythropoiesis that leads to increase in hemoglobin concentration and ferritin level. Increase in ferritin level because of excessive iron stored as a ferritins, which is an important lethal finding in COVID-19 patients. Increased hemoglobin level and ferritin concentrations leads to hyperviscosity of blood, which can produce thrombotic events and sudden death of patients. Next, this released free iron ions are toxic to lung, so it leads to inflammations in lungs due to alveolar infiltrations of macrophages and monocytes. This inflammatory procedures produces ARDS, and increased inflammatory cells produces monocytosis and relative lymphocytopenia in hemogram. This theory explains that initially mechanical ventilation is not so much effective in treatment. In fact, it may be futile and causing more lung damage. Besides this mechanical ventilation, oxygen therapy with BiPAP or other modes are much more beneficial as it resolves hypoxemia. Now, what is the actions of chloroquine and hydroxychloroquine in this mechanism? Action of chloroquine is similar as against malarial parasites in RBC, that it protects hemoglobin against invasion by viruses. So, in this newer concept, important finding is that ARDS not a primary finding, it is secondary to hypoxia. Thank you.
दुनिया हिला दी एक वायरस ने जिसका नाम कोरोना, हिंदुस्तानी कहता इससे डरो ना, और